Hey, welcome to the workshop. So in this video, I'm going to talk a little bit about my latest surgery. I'm just coming off a full hip replacement surgery, and what I want to talk about is kind of my journey through that, through the recovery, and getting back on the bike. So I hope you enjoy this. So back in 2023, some of you may have seen a video I put up about a complete knee replacement that I had done and the recovery process after that surgery and getting back on the bike. This video is kind of be very similar, but with respect to a hip replacement. So I relocated last year from Connecticut to South Carolina. And in doing so, I needed to find a new orthopedic surgeon. I've always known that my left knee also needs to get replaced. So I found a surgeon. I went to his office to talk about the process and when I can start working on the replacement of the left knee. While I was there, I also complained about some pain in my hip. And that was diagnosed a few years ago as a hip bursa. So I didn't really put much concern on that. I just did stretching and exercising. You know, the pain would come and go. But it got to a point where the pain was pretty severe. It wasn't going away. I was having trouble sleeping. So when I mentioned this to the doctor, he took some additional X-rays, and we met back in his office. And he's like, "Okay, so two things. One, let's talk about your knee. You're correct. You do need to have your left knee replaced, similar to your right knee." But that's not really urgent. You can put that off a year. You can put that off for 2 years, depending on what level of pain you wanna subject yourself to. But in the meantime, there's also the option of a cortisone shot. So I said, all right, well, I'll think about that. He's like, but now let's talk about your hip. Your hip has got some severe arthritis, and that's the pain you're feeling. That's not going to go away. The solution is to have a hip replacement surgery. They're very common these days. It's outpatient. It's a 1-hour surgery, 4-hour recovery, and you're home. You're home back comfortably in your own house that same day. So at the time, it was last summer. I wanted to ride my bike through the year. Now, riding a bike didn't hurt the hip. It didn't hurt at all when I rode because of the position I was in. But after the ride, when I got home, that night when I was trying to sleep, that's when it hurt. Getting in and out of a car, after a drive, you get out of a car, ouch, this hurts. I can't get up. It takes me a while to extend my leg. The same getting up and out of a chair. So it's these things that hurt. Riding the bike, it was in a position where there really wasn't much stress on it. So, I could go on the bike rides. But what I did do is I got the cortisone shot in my hip. That did work very well. It made all the residual pain as a result of the hip go away. My hip manifested in a few different ways where I did have hip pain, but I also had lower back pain that was pretty severe, and I had groin pain. So after the cortisone shot, all that went away. So that was kind of a sign to say, hey, this is really the problem. This is the problem of all your aches and pains, right, so to speak. So So I scheduled that surgery for March of this year. I went in March 5th and I had the surgery. This video is being taken just 4 weeks past the surgery. So I've got, I've got some history. I've been going to physical therapy, but in essence, you go in the morning, they give you, all your prep. You get you ready for surgery, boom, you're in and out. They like to get the surgeries done in the morning. My surgeon that day had done 3 hips. I was the second one in line. I was back home that day, and physical therapy started the very next day. You'll see I've got some clips of some of the exercises I did during physical therapy. I've kind of broken those into different levels of severity, as levels of workout. So in the beginning, they're very easy. Then they go to like an intermediate and a more difficult. So as you go, they start to concentrate on rebuilding the muscle. The hip itself, the joint itself, I don't feel any pain. that feels good. It's the muscle group around that is, you know, they have to cut through some muscle. They can't avoid it. There's the trauma for the surgery, and all that has to heal. And that's what aches, you know, when you're trying to lift your leg. And that's what the physical therapy is working on, is to re-strengthen those muscles. So in this video, you'll see coming up soon is some pictures I took, some recovery through physical therapy, getting back on the bike in the beginning and doing some riding afterward. And I also wanted to touch on a few things with regards to mobility after your surgery. So the first 7 days or so, I was on a walker. It just hurt to put a lot of pressure on your legs. So you use a walker. They teach you how to use the walker in therapy. Then you just progress. I progressed to a cane after that, and I just kind of knew. I knew when it was time to go to a cane. You know, therapy didn't say, "Hey, it's time for a cane," but as you're moving around, you say, "Hey, you know, I've got enough strength. I know how to use a cane. I'm going to progress to the cane." So I did that after 7 days for about 7 days, maybe 10 at the most, and then after 2.5 weeks of using either the walker or the cane, I just started walking. The walking helps you to progress a lot sooner. Is my history with this. Is it helps you keep your body straight when you're moving. It takes away a lot of the, of course, the crutch, right? That's why it's called the crutch, but it takes that away. And what I was finding out is I was kind of cheating toward my left side when I was using the cane, and it was putting a lot of pressure on my left knee. And that's the knee that, of course, needs to get replaced. So I had more pain on my left knee than I did on my hip. So I moved right to just walking as soon as I can. It keeps you nice and straight, balanced. You want to make sure you got a good steady step before you release. But it also helps you to build those muscles up quicker. Walking is very good for the recovery after this surgery. So enjoy, and if you have any comments, you can leave them at the end. Thank you. So here's just a quick picture of some x-rays of my hip before and after. These exercises are the simple ones, week 1 therapy, just some leg extensions. These were 10 times each leg for 3 sets. So you do 30 of them. And you want to do them nice and slow to get the muscle activated. All of these exercises I did on both legs just to even it out. This is a stretch. You take your non-surgical leg, your good leg, you pull it up to your chest, and you straighten out your leg that you had operated on, and it gives a good stretch on the groin area. That's important in the beginning. These heel slides are very good in the beginning, and it helps activate the thigh muscle that it was probably cut into. And again, I do these on both sides. It's 10 each, 3 sets. This is again another heel slide, but out to the side, right, giving you some lateral motion. These are all very good on the first week. Low impact, and they're very beneficial. These are arches. This is like a little stretch. Kind of stretches your lower back. Again, you do 30 of those on a 5-second count. These are ball compressions with your knees. You squeeze the ball. Again, it's a 5 count, 10 repetition, 10 reps at 3 times each. And this is just an elastic band doing the opposite of the ball compression. This is just a stretch pulling your thighs outward. Again, 5-second count, 3 sets of 10. This is like a laying down march, right? Lift your leg up, get that thigh pulling your knee all the way up to your chest. You alternate these, and again, 30 times. This is where it gets a little bit more. You pick it up a little bit. You want to get a little bit of added therapy. I did these in addition to the week 1 therapy, so I just kept adding them together. So by the time, of course, I get to week 4, I've got a half an hour of therapy versus 10 minutes because I continue to do the ones in the beginning. Again, a march. This is a standing march. You want to lift your knees as high as you can. Total of 30 reps in 3 sets of 10. This is a really good one. This is a stretch your leg out and then lift it, right? Extend your bottom leg and then lift with the thigh. This is a sideways lift. very similar, but you get the weight of your leg laying down. Stepping upstairs. So this one here is a balance exercise. So without holding on, stand on your leg and lift and pretend you're going to take that step. You can even tap the step if you like. These are actually stepping up. This is again 3 sets of 10. Nice and slow. You want to step up and then step back down, leading with your good leg. And you can do those sideways as well. This is me in therapy on the exercise bike. Hey, so I'm excited to be back on a bike. After 17 days, the therapist cleared me to ride a stationary bike. So you probably saw in the previous picture, there's a small stationary bike at PT that they had me on. And then I asked if I can ride my stationary bike at home, and they said, yes, you can. Just be careful getting on and off. Make sure you swing over the saddle with your good leg. So, like I said, after 17 days, I'm on the trainer. I feel really good. I start off slow. I'm only running about 75 watts, and I'm only going to ride like 5 miles. And then over the next week, I'll skip every other day and then slowly increase the wattage in the miles until I get up to half an hour or 45 minutes on the trainer, 125 to 150 watts, and then that'll be a good recovery. If I can get to that point in 2 weeks, that'd be fine. And then that'll be a good transition to get me outside and riding the bike around the neighborhood. The muscles feel good. It feels good to ride a bike. This position is very easy on the hip. It's not load bearing. So after any of these exercises, after even like physical therapy, when you do physical therapy at home, or if you ride like I am on the stationary trainer right now, what's going to be important is when I finish is to sit down, relax, elevate my leg, and get some ice on my hip. This is, like I said, it's only been a couple of weeks past surgery. This is quite a strenuous activity for the muscles around my hip. So you want to just make sure you don't overdo it. Thanks. Okay, so let's talk pain management. What did I do to alleviate the pain or or minimize the pain after the surgery? So when they're getting ready to send you home from the hospital, they're going to give you some painkillers. Now, in my case, the oxycodone or the Percocets that they had given me for my knee surgery, they made me very nauseous. So I had talked to the surgeon beforehand and said, hey, is there a different option? And he said there is a synthetic opioid that he could try. He says it doesn't quite have the same characteristics to make you nauseous. So I tried that. So they sent me home with the synthetic. I took those for 2 days. They worked. As a painkiller, they worked just fine. But I was getting a real bad headache. And the headache was worse than the pain. So I stopped taking those. But what I did do is I found my own solution. The Tylenol with Motrin mix, or you can take Tylenol and a Motrin. But I bought some Tylenol Motrin combination, some tablets, and I took those 2 tablets 3 times a day, and that worked just fine. And I did that from 2 days after the surgery up until 3 weeks after the surgery. Now I'm 4 weeks past surgery, and I take the Tylenol / Motrin mix before I go to bed. That's all I do for now with pain management. So that's what worked for me. Like I said, I didn't like the painkillers that they prescribed. They just have side effects that didn't agree with me. Another very important thing with regards to pain management is elevation, right? So you want to keep your leg elevated to minimize the swelling. As soon as the swelling gets out of control, that's going to cause a lot of pain. It'll cause, in my case, knee pain, hip pain. My ankles hurt. I mean, it just translated the pain all up and down my leg. So you want to keep the leg elevated and you want to keep it iced. You can't say how important icing is. It's so important in these surgeries. So you need an icing strategy, right? You can't just get bags of ice. They melt and they make a mess. But they do have ice packs that you can buy. And in my case, I bought two ice packs to have like it's like beans inside, a very fine, hard bean bag. They're good size. Throw them in the freezer. Keep 2 of them in rotation. Take them out. Now, what I found is the bean bag ice packs last about a half an hour. So every half an hour, you're flipping them around, and sometimes you're putting 2 on. So you might want more than 1 or more than 2. But then they also have very specific ice packs with Velcro straps on them and things. And they have a solution inside. Instead of the beans, they have like a solution, and that freezes, and it lasts over an hour. They're pretty good. They're pretty good. They're very cold, so you have to make sure you put a towel or something in between, or you have a pair of gym shorts or sweatpants on. You don't want to put it directly onto your skin. That would cause a lot more pain. But the ones with I guess it's some sort of chemical solution inside, they'll actually form around. We bought one that was hip specific, so it wrapped around your hip, but then it had 2 straps. One went around your waist and one went around your upper thigh. So it held it in place very nicely. That's a good one to go to bed with, right? So it'll keep you cool and keep you iced up until you fall asleep. And then maybe 2 hours later, when it's no longer effective, in my case, you wake up. I've had a lot of trouble sleeping with the pain and the aching, so so I try to do my best to sleep through the night. Sometimes I end up getting up early in the morning, just grabbing some more ice and sitting in a recliner with some ice on it and fall asleep in a recliner. But yeah, so pain management, that's a very important part of this process. So 4 weeks past surgery, I'm back on my bike. I'm just pedaling nice and easy around the neighborhood. And I'm not going to go very far, maybe 8 or 10 miles at max. I'm not ready to ride with the ride group yet. My muscles where they had to cut through for the surgery just get very tired. So after 5 or 6 or 7 miles of riding, I'm pretty tired. I can't keep up the wattage that I'm going to need for the ride group. So I'm going to give that 2 more weeks. That's going to be my target. So it's 6 weeks. I want to try to ride with the ride group. But I tell you, it feels good to be on the bike. I haven't ridden a bike outside now for 5 weeks. It feels good. Feels good to spin the legs. So I'm now 5 weeks past my surgery date, and I'm going to get ready for another little ride around the neighborhood. I've got about 1 more week left before I'm going to start riding with the ride groups, but I'm getting pretty excited about this. So, like and subscribe if you like this video, and thank you very much for watching.